can transmit that to the next generation. Type 2. Type 2 is definitely having a very strong genetic predisposition. But type 2 has also got many other factors which can influence whether a person can get diabetes or not. Even if you get the genes of diabetes of type 2 from your father or your mother, or probably both, if you maintain a good lifestyle, if you have a very good BMI, which is your body mass index, if you have a very good eating habits, if you have very good living conditions, chances of you getting diabetes earlier on is lesser. But it doesn't remove the factor that you will get diabetes or not. So you have to take care if you have type 2 in your family. But doesn't mean that every person will get type 2 also. Lifestyle changes like diet, exercise, eating healthy, consuming minimum amounts of alcohol, definitely no smoking, all contribute towards the possibility of you not getting type 2 diabetes. I just wanted to mention a few points today about family and diabetes. What is the role between family and diabetes? So the first question is, can diabetes be a family disease? There are two types of diabetes. You have type 1 and you have type 2, and both of these conditions, both type 1 diabetes and type 2 diabetes, have a very strong association with genetic patterns. Type 1 is usually predominantly a genetic disease where there are autoimmune antibodies which work against your insulin and against your pancreas and cause you diabetes by creating a lack of insulin. Type 2 is a genetic predisposition wherein your body, because of multiple factors, also a genetic factor, can have diabetes because of weight, because of diet lifestyle changes, because of your mother or father or probably both having diabetes, or because diabetes runs in your family. So yes, to answer that question, is diabetes a family disease? It has the chances of becoming a family disease, and it's usually seen in families. So when we talk about type 1 or type 2, when we talk about type 1 is definitely a hereditary disease, but it does not mean that every person who has got type 1 in their family should get diabetes, type 1 diabetes. The prime example being, if there are twins, there is a chance that one can get diabetes and the other one may not. And along with this, there are many studies which show that type 1 is predominantly because of antibodies, which is against your insulin. Type 1 has got a higher chance of having a genetic factor, but not everybody who has got type 1 in the family can transmit that to the next generation. So the question you would have to ask is, do you have for example, if you are diabetic, do you have a risk of passing on diabetes to the next generation? Yes. You have to take into consideration that genes will always be passed on to the next generation. But along with that, you have to make sure that these patients or your family members should be counseled about how to modify your lifestyle, how to eat healthy, how to maintain proper weight, how to exercise regularly, and avoid all sorts of stimulants like alcohol and cigarettes and smoking and tobacco in various forms, which can cause these younger generation or the next generation to get diabetes. Also, what is noticed that in today's lifestyle, in today's day and age, we see younger and younger patients coming in with freshly diagnosed diabetes. Now, why is this happening? There are many factors here as well. One is the lifestyle. All of these young patients nowadays who come with new diagnosed diabetes is probably because of very poor lifestyle. Most of them are not exercising, most of them are not eating healthy, they're not taking care of their health, they're not, maintaining their diet and their exercise and lifestyle the way they should. Plus, because of all the fast food and because of all the sugary drinks and because of all the various food choices that they make, there is a chance, and of course the obesity that is predominant among the younger generation now makes these individuals more prone to type 2 diabetes than the older generation. There was a time when we would consider diabetes to be a disease you would get around the time when you were retiring from your job. But now you see younger people getting diabetes when they start their job. So the entire picture of diabetes is changing, and I think as a family, it's very important to have this counseling with families where they understand the importance of diet, lifestyle modifications, exercise, and regular checkups, which actually work in their favor. There's another point I would like to speak about is what is it, in case you have diabetes or someone in your family has diabetes, what is a diabetic emergency? There are two ways of having diabetic emergency. Either your sugars are very high or your sugars are very low. And many times you see patients who have low sugar diabetic emergencies are those patients who take insulin or they're on medication of diabetes which causes a rapid drop in blood sugar. And also this low sugar diabetes emergency is mostly seen in older individuals than a younger person. Both of these things to be taken care of at a different level. If your sugars are too low, then you have to follow what is called as the 15-minute rule. How do you tackle a sugar which is low? First of all, every diabetic patient should have a glucometer in which they can check their sugars at home, because that is the best way to understand whether your sugar is high or your sugar is low and how you can deal with this situation at home. So if you use a glucometer and if your sugar readings are below 70 or 60, usually we recommend the 15-minute rule. Give 15 grams of sugar or carbohydrate. Monitor the sugar after 15 minutes. If it's still not high, give again 15 grams of sugar and monitor it after 15 minutes. This continues every 15 minutes. And then after 1 hour, you can check. Once the sugars come back to normal, check again after 1 hour. In case the sugars are not climbing, then the best thing to do is to take the patient to a casualty or an emergency room where they will be given IV glucose, and then they'll probably be admitted for 24 hours to make sure that they don't go into further complications. If the sugars are very high, then it's probably the patient is going into a diabetic coma, because that is one very dangerous possibility. In these cases, I would advise you to take the patient to the nearest hospital. If the sugars are above 400 and the patient is not feeling well, it's always advisable to either go to your practitioner, to your medical practitioner, or you go to the nearby hospital where they will advise you insulin under observation and bring your sugars down over a period of time. In both the emergencies, there is a chance of admission, which is obviously going to be beneficial for the patient so that these instances can be avoided in future. So my summary of all of this is, if one of your parents has diabetes, there is a very good chance of the next generation getting 30% of those patients can get diabetes. If both your parents have diabetes, you have a 60% chance of getting diabetes. And family history definitely matters, family counseling matters. So my advice to you is eat healthy, exercise every day, maintain your weight in the proper BMI, and get yourself regularly checked at least once a year.